Okay, I want to get to the DNA of things. Hi, what's your name?
Cadillac.
And you do genetic testing, is that it?
I'm a holistic practitioner and a genomic counselor with Genetics Canada.
Sorry, genomics counselor, what is that?
That means that I've studied the interpretation of genes and algorithms, so I can actually make sense of the reports that patients get through me.
Genes and algorithms, what's the numbers on that?
Okay, well, algorithms are the math and the science. It's actually linear algebra, and that's what is run to determine if people have any risks for complex health conditions.
So what else can you see, or how has it really helped someone by understanding their DNA blueprints?
Well, actually, there's some pretty amazing stories, and that's what made me get more into it as a practitioner. For example, a lot of genes cross-reference and mimic other health conditions. So for doctors, and we all know how our healthcare system is, for example, they may prescribe medication for one disease when in fact some of the symptoms are mimicking another. And I've had one case with one doctor we were working with where someone was being treated for Parkinson's and actually told they had 6 months to live. We ran a complex health condition. They had no variants at all for that disease and turned out to have Alzheimer's. And he's walking and living amongst us now, and it was a total change of health destiny for him.
Is that person medication free?
No, he's had to taper into other medication, but his quality of life can't be compared, and he doesn't have a death sentence. We have other people too that are being told they have IBS, which we know means nothing, and I can do a panel on different conditions there and better diagnose it, and then my first line of treatment is always nutrition first.
So as you know, everything's in the diagnostic tool, right, or technology. This seems to be obviously the cutting edge. How new is this?
Well, DNA has actually been around. It was discovered in the 1950s, and right now we're still doing what's called sequencing on the SNPs of the gene. That's the different components of the actual gene. But for example, our clinic is going to be introducing in 2 weeks 2 tests that do whole sequencing, which will better allow me to diagnose weight loss and fitness options for individuals. And whole sequencing is sort of the next stage before we get into like real individualized medicine.
So what's the process? What's involved? Would you get a blood test or what?
No, actually the best way to do DNA is to extract it through saliva. So some of mine are through a swab, some of mine I have them spit into and get a certain amount, and that's where we extract the best form of DNA. We only use blood at our clinic to actually blood type people. Everything else is saliva based.
So I get my swab test done. What's the timeline to see you and see results?
It varies between tests, anywhere between 1 week to 4 weeks, depending on the size of the panel. And then when you come back, I do what's called a report of finding. And part of our service is we have an extensive 2-month post program where I design a lifestyle nutrition plan. And those are really the tools that give you your health destiny.
And so what are the fees regarding this service?
They vary. Most of our plans, I would say, are between $900 to $4,000. $4,000 is a very extensive program we do for people with BRCA gene. But again, that's a very, very small percentage of the population. An average program, we have a special for the show, is around $1,450.
So how many practitioners of this type are there in Canada or Ontario?
Not a lot. I work with one other doctor who's a specialist in Richmond Hill, but I would say there's maybe a handful of us, maybe a couple more in British Columbia, but the bulk of my colleagues, this is very big in the United States and in Europe. The difference is with our clinic is we're private. We don't sell the data, we destroy your data. You don't even have to give us your name. You're protected with your insurance company and your medical files.
Very nice. Okay, so I walk into the clinic, I get a test, I got something. What kind of, how long will it take to, say, improve? Do you actually correct the DNA problem, or you just understand it and then support it through nutrition and stuff like that? Because I know you can change your DNA.
Right.
You can raise the vibration, the frequency, which affects everything else.
Well, yeah, there's science and math behind that, but what we're doing is doing your risk analysis. So for example, let's take diabetes 1, very popular, very high rate of that. If someone comes back with high risk, I'm going to blood type you. I'm going to do a lot more intensive history on any other conditions you have. And then my first goal is through nutrition to get your system functioning better, because the whole trick is, and people don't understand it, we all have genes that have expressions. It's the environment that triggers them. And people need to understand that just because you're at high risk for even breast cancer, you don't necessarily have to trigger that. And my foundation of my academic training tells me that nutrition is step one, and lifestyle, all the stresses, your job, all of those other factors, those cofactors or epigenetics, those are the things that prevent you from having those things manifest.
So what do I do? Do I just walk into someone like you, or do I have to go through a doctor?
Well, no, you can actually come to me because of my skill set, and I can do the consultation. It's an interactive 1-hour consultation. I do take referrals from doctors as well. So you can call the clinic. I do a 15-minute complimentary consult to sort of get a feel for what you exactly need. And then from there, I would set up a 1-hour interactive consultation.
Great. So more information, your website is?
geneticscanada.com, and we have a very easy number. It's 844 DNA gene. That's GENE.
Thank you.